Hello, hello. I'm Laura Hockman. I'm the medical matchmaker, practicing family medicine physician, and I help physician owned practices to find doctors to join them. And with me today, I have Dr. Ann Truong. She is a physical medicine rehabilitation doctor, still practicing medicine, a serial entrepreneur, and really does a lot of work with doctors helping to create their online businesses. So, Dr. Truong, thank you for being here today.
Thank you for having me here, Laura.
I'm so excited to have you here. I wanted to talk to you a little bit about how to create an online business, why to create an online business. But before we even do that, can you tell me a little bit about how having something that's technically not medical, but and yet you're using your expertise, how has that kept you enjoying the practice of medicine? Like, how has it changed your outlook on practicing?
Right. That's a great question. In fact, to be able to uh, 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 like be more impactful outside of the in office, because when you're in the office, you're seeing patient one to one, right? But when you're online, sharing your medical expertise for people that really need the information that that are now being misled on Google or whatever they read, but you're sharing your knowledge, your expertise, and you feel that you make an impact. It really circle back to why I went back to medicine, why I did medicine at the age of 22 years old. I was one of those student that went from undergrad to med school. I never really had another job aside from when I was working at McDonald's when I was in high school. I went straight through, but it really brought me back to my roots as to why I went to med school in the first place and really enjoying the impact that I'm making outside of my practice because I've been in practice since 1997. And I really enjoy seeing the transformation in my patient in the office. But there are days that I just feel exhausted. I would I only work 3 days a week now, but I used to work 5 days a week and at least 10, 12 hour days and was taking insurance. Then I stopped taking insurance in 2019. But when I found out that I was able to have generate revenue online, and this is not telemedicine. I'm not talking about telemedicine at all. I'm talking about educating the public on just important aspects such as sexual health, or even for family medicine doctor, how to control your blood pressure or how to lower your blood sugars and all that. To really educating on something that's impactful for them, and then feeling gratified that you're actually making an impact on something that you take for granted, that you can say at top of your head in 10 seconds, where somebody is really need that information to really transform their life.
What are your thoughts on all the different platforms or different types of content, I should say? So blog posts, YouTube, there's so many different ways of giving information, courses. What are your thoughts on all the different types
Yeah.
of content?
Well, YouTube, by far YouTube, because YouTube is also owned by Google. Right? So when you're producing content on YouTube, you're also being searchable on Google. And Google number one search platform. 70% of people search online on Google, and that is the only social platform that can be searchable. If you do your content on Facebook, that's not searchable on Google or Instagram or TikTok. When you put out your content or record a video and it goes on YouTube, it lives there forever until you take it down. And versus when you put a video out on Instagram or Facebook, that actually only stays for a few minutes and it's gone. So it's like you're putting it out there and you're hoping whoever's online at that time sees your video, and that's it. It doesn't show again to that viewer unless that viewer go to your go to your account and try to watch everything. But you know that we live in a busy world. No, very little people, very few is going to do that. Versus YouTube, like I put out a video that was in 2020 that is still gathering views right now. And we're at now 1.5 million views for that video that I made. I think it was like the end of 2020 when I started getting into YouTube at that time. That's still gathering views. And YouTube is paying me to produce the content. So that's the only social platform that will pay you for producing content that is worthwhile and be searchable on search engines such as Google. So my preference is YouTube because there's two reasons why people go on YouTube is to learn something or to be entertained. And so that's why they're there. That is and was my preferred platform to get information. If I wanted to know how to learn how to bake bread from scratch, I go to YouTube because I can see the video, I can copy it, and follow the instruction. Honestly, the only other social platform I'm really on is Facebook. Instagram, I'm still having trouble trying to navigate the different buttons on the Instagram and TikTok. Where I'm on there, but I have no idea how to use the button on TikTok. I'm old fashioned, but I stick with what I'm comfortable with. But I'm very comfortable on YouTube. It's very easy to publish, and it's free. But what the beautiful part is that whatever content you put out there, people can still find you years later.
That's a good point. So, for maybe a doctor who wants to start a YouTube channel but doesn't know where to start, what do you think? We're such perfectionists, we're so type A. What do
Yeah.
you think about starting your YouTube channel? How do you start it? How do you keep it going? All those
Y-
things.
Right, right. So, as doctors, and I work with doctors, and we coach doctors to kind of start their business online. Is that they overthink the step they need to do. They just have to make the decision. I'm just going to do it and do it tomorrow. Prior to starting here, I said, well, check it out today. Success like speed and success like action. Right. So if you speed things up, you will get more resistance in why you shouldn't do it. That's what I've learned from all the last 4 years of being coach is that a success like speed, and you just have to do it. Once you do it, then you'll be able to learn from that. So how did they start? Is well, first of all, creating an account YouTube is free. You have to set up a Gmail account, and then there are oh my goodness, who has a free course? I believe Pat Flynn has a free course on this, and John Lee Dumas, Dumas, has a free course on how to set up a YouTube channel as well. I believe in that. If you want to be accelerate your progress and speed up your progress, is to get with somebody who's been there, done that, and knows the rope, so that way they can show you the step on how to get there quicker as well. And so that's my attitude. I learned that from Alex Hormozy. I go for speed and leverage. The least amount of time with the most effort is what I look for in everything that I do. And that's why I said speed first, action first, do it, and then learn the framework and just putting content out there. That's how I did it when I first did it. I just did it. It was my video was horrible, but I've learned, and I've also paid for coaches and mentor that helped me along the way, and how to strategically find content. Now, I will be honest with you. You can't. It's not like you open up a channel on YouTube and you're going to be successful. There's a way that you put out content out there that attract viewers, that become subscribers, which then become buyers. Because you can produce content all you want, but if you're not making money on a channel, whether it's Instagram or Facebook or YouTube, you're gonna burn out. Right? You're gonna burn out because you got to get some ROI to when you're doing that. So the way to monetize, there's a word called monetize, meaning making money online from people watching your video you put out. That's very strategic. And we have figured out the framework on how to do that, because that's why I do it. I do it because I want to educate people, but I also have to run a business too, and I have two editors that help me with my content. I gotta pay them, and so the money is in how you put out the content that people like and trust you, that they then follow you, and then they then buy from you, whatever that may be, a course, that may be a membership, maybe supplement, that maybe come into your office to see you for treatment. And then other thing too, when you're out there and you have more subscribers, and we just recently crossed 100,000 subscribers, how I got the silver plaque from YouTube.
Congratulations.
Oh, thank you. But what that means is that other brands are now reaching out to me to sponsor, wanting to be a sponsor on our video. Meaning, if I do produce a video, they insert in like a 20-second commercial in my video, and they pay me for it. So it's kind of like when you have a YouTube and you have a large subscriber, and large means over 25,000 subscribers, is that you start to be an influencer. You influence how people think and buy. And like it's like you, as if you have your own show. It's like you're an ABC, NBC, because it's your channel. It's up to you to put what content is out there, but it's also up to you to nourish that channel and to grow that. And that's why other brand wants that exposure. What we're doing also is one of the things I want to give value for your listeners is that we have a free newsletter. So what I do, I when I give out content, I have the viewers go to my free newsletter. I get their email, I get their number, and I get their name, and it's free. But the newsletter is my newsletter. It's like my Wall Street Journal. All right, is that I put content in there, which is my YouTube channel, but I also have other brand that will put a little blurb about a little ad about their product in there as well. So they pay me to be on the newsletter, which is a digital newsletter, and then they also pay me to put a little blurb on my video. So that's how you can kind of have multiple ways of monetizing by uh, um, talking about your content teaching. For me, I talk about sexual health. Well, then I tell them go up into my newsletter. I also have a membership as well, which they pay a monthly membership for to be a member of that. They get perks. They get perks of discount on supplement, asking me question live, and also different content that I put out for them as well. And then we also have an e-commerce store where we sell supplements and medical devices as well. And then also having them come to the office for our high ticket, which our treatment is from $10,000 and up at this point. So I currently right now have 14 sources of income that is generated from the content that I put out on YouTube.
And are
Um,
you pretty much only on YouTube, or do you use the other Instagram and Facebook and LinkedIn and all of those as well?
Right. Where I'm the content that I strategically put out is geared toward YouTube viewers, but we take that same content and repurpose it for Instagram, Facebook, TikTok, yeah, and LinkedIn as well. And that's it. But I'm not focused. I don't even know how many followers I have on Instagram or TikTok at all. I don't pay attention to that. I really pay more attention to YouTube, but it doesn't hurt to be on multiple channels, because the more multiple channels you have, the more cumulative subscribers you have, and more chances for you to monetize as well. So the hardest part about a lot of influencer or anyone that's online is how do you make money? It's easy to put out content, right? It's easy to put out things to educate that when you're an expert about, but how do you make money? How do you have people buy something from you that will at least cover your costs of doing that? And a lot of people get burned out because they don't figure out how to strategically do that. And I think as doctors, we have so much information between our ears right here that there are how many are like 350 million people in the US searching for information, such as easy information, such as, well, how do I lower my blood sugar if I'm a diabetic? How do I control my blood pressure? How do I sleep? How do I sleep better? How do I get off of my antidepressant medicine? And just simple things that you answer every day to your patient and you educate your patient for. You can just hone in on one area. Let's say, your family practice, right? Just hone in on like, well, how to how to lower your hemoglobin A1C from 8 to 6 in 3 months. Be that specific and just talk about that for every week for about 3 months, and then you can extend to like, well, now how to exercise. So the things that we know people are dying and searching for, and unfortunately there's a lot of misinformation out there on Google. And there is, if you search, there's always information that is really not supported, and the public is being misled. And I think that as doctors, you owe it to yourself, and you really owe it to the public to really educate information that works as research based.
Yeah, that's very true. So listening to you, you're working 3 days a week. So this means you do this all in 2 days. I mean, you're working 5 days a week, I'm sure, but you're in
Yeah.
clinic 2 days a week. How do you delegate? How do you manage all these tasks without getting overwhelmed by all the things, doing all the things?
Yes, yes. So on the days I have clinic is the day I focus on clinical stuff. Right. So I'm very when I have to finish my charting that day, and I don't do anything online that's related to my online business those 3 days. I focus on just the clinical as well. I have to say I have a very good clinical team that support me. So I just only focus, and we don't take insurance. That's another thing. We don't take insurance, so we don't have to deal with any type of authorization or approval, anything like that. So we see a patient, we get paid right then and there, no billing, and nothing, and so we have less administrative burden than a doctor that takes insurance. I have one clinic, one front desk person, one nurse working with me, and they're very good at what they do. They get everything ready for me. I just focus on clinical, but those 3 days is all clinical. I go home and I exercise, and I'm very protective of my mental health and my mindset. And then on Thursday and Friday, like we are talking today, is when I focus on my online business, where I go into the entrepreneur hat and focus on the online. And then I have to say, sometime I'll record videos on Fridays. I'll batch record. So I put out 2 videos a week. So I'll do like 10 videos in one sitting. But their videos are like less than 10 minutes. Less than 10 minutes. But we spend a lot of time researching the topic. We spend time researching how to phrase the title so it can be SEO optimized. It can be searchable. We spend a lot of time with the thumbnail. So to put out content, you have to reverse engineer. We have to reverse engineer from the end. What do you want viewers to want to learn? And then you reverse engineer your title and your topic and your thumbnail. Then you produce the content last. Most people produce the content and do the thumbnail later. We have to reverse engineer to the endpoint, and then the design, and then you record. So that so my team and I. So I have a separate team. I really have really three businesses. Where we have the clinical business, and then we have another business that is focusing online, and we have actually 5 employees in that online business right now, because it takes people to edit the video, it takes people to do the research, and it takes people to also help me with the podcast production and so forth. But they're all my VAs that I've trained. I have the final approval on the final edit and what it looks like. So so they put out multiple versions of something, and I'll choose which version that I feel is best, and I do the content creation. So what I've learned in being in business, and doctor, one of the advice is stay in your lane of genius. Don't try to wear too many hats. When you try to wear too many hats, you're not gonna be the best at everything. All right, you're gonna get burned out. And oftentimes we first start out, we go, well, I don't have the money to do that. Oftentimes when you pay somebody, you make more money because you spend more time in your lane of genius or your strength to produce more, and then that person will support you. So, when you first start out, yes, you can, but as soon as you can, get someone to support you, so that way you can produce the content or do the activity that can generate money for you, and instead of trying to do four different things at the same time. So, so I prioritize that, and on weekend I try not to work on weekends, but sometimes I'll do like Sunday night. I focus on topic because I'm very like if I see something that is trending on TV or something, I'll produce a video that will coincide with what's trending. Like I'm gonna be doing a video about the presidential debate that would just happened this past Tuesday, and I'm gonna tie it to what I'm talking about, or how am I tying sexual health to a presidential debate, right? Well, I'm gonna talk about healthcare. I'm gonna talk about how healthcare, how you can optimize their health into that. So all doctors, I mean, when you hear something that's trending that people are real into, tie whatever you're doing to that, right? Because health goes with everything, right? The health goes with everything. And I would tell you, as doctors, your people are dying to hear from you. People are dying to learn from you, because the health information, it cannot, it's all customized, right? Not all of our patients are the same. And as the doctor, within 30 seconds in the office, you already know, boom, 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 what you're gonna do with that patient. But that's a skill that we it took us what, at least 12 years, 16 years to learn if you do fellowship. But that's something that we take for granted when patients just need to know, like simple things like what's complex carb, what is it I'm doing to elevate my hemoglobin A1C, and what does hemoglobin A1C mean? Because nowadays, you only allow what, 7 minutes, 10 minutes max with a patient, because you have to see so many patients if you're taking insurance now. I mean, you have to see what the other day I was talking to one of my colleagues that was taking insurance. She's seeing 72 patients a day.
What?
72 patients a day. That's crazy. I don't know how anybody can do that. I see 10 patients a day and I'm complaining. Uh, I'm complaining. I'm seeing 10 patients a day, and I only work from 9. I only work from 9 to 4. And but she saw 72 patients a day taking insurance.
Wow. When do
Yeah.
you chart? When do you do the authorizations? When do you do all the
The
other
next
extra
day,
admin?
yeah,
Oh my
yeah.
gosh.
Well, that's why we have burnout, right? Because you have no. I mean, but what I'm trying to say, if you're seeing like 10 minutes or 5 minutes per patient, how you gonna educate them about their health and preventative measure? You're just gonna write a prescription and or whatever, adjust the prescription, just one thing, and that's it. And then next time you see them, probably a month later. So it's something that doctors need to kind of take ownership. That's why my
Right.
company is called Doctor Boss. It's giving doctor back to be the boss of their life, their business, and their everything. And I love the name Doctor Boss because it's an empowerment term. Because I feel that as doctors, we've been told since what, undergrad, do this, do this, do this, right? And you get out, you're told by the insurance company, this is all you can do. You're not authorized. You're not authorized to order that MRI because somebody is at the desk that just graduated high school tell you you can't, order that MRI on somebody that can't walk, unless they fail 6 weeks of physical therapy. Believe me, I live in the insurance world and I do pain management, and oftentimes it's like, oh, you can't raise your shoulder, but you got to do 6 weeks of physical therapy before that patient can get a cortisone injection to help them, with their pain. And they're 80 years old, but they got to fail physical therapy first before they can pay that. And so, but both you and I know that doing 6 weeks of physical therapy isn't going to alleviate an acute pain that you can't even lift your arm, take out your clothes
Right.
for, right?
Right.
Because you need to do that every day, right? They get better, but not right away. But the point I'm trying to make is that your physician and you feel that you're on a hamster wheel and you're burnt out. There are ways for you to make money online, and that's just not telemedicine. It's really educating. I have doctors ask me, well, what about liability or malpractice? Because you're not treating patient, you're just educating, which is no different than influencer, that like Mr. Beast, talk, it would entertain. You're just educated, but it's up to the person listening to the content whether they want to execute on what you say or not. But you're not their doctor because you are not and I put a disclaimer on my YouTube video on the bottom that all information educational purpose. I am not your doctor at all. You have to discuss with your doctor before you implement anything that I talk about. And what people really want to learn from, and this is another good pearl for listeners as a doctor, is that things that they can do on their own to help them with their health issues. Things that they can do that because people really do want to get better, but most of the time they don't know what to do, or that
Right.
they do one thing, it didn't work, and they get frustrated, and then they don't trust the process anymore. But your job is to educate them that there are things that they can do, and these are XYZ that they can do, and even as something as simple as knowing what simple carb is and complex carb is, and holding up the food itself, and educating patients, because I can tell you, working with sexual health, a diet is a big key factor. And people don't realize that drinking 3 Coke a day is not good. People don't realize that eating a hamburger a day is not good, and that elevate their cholesterol. They just don't know.
Mhm. Yeah.
Yeah.
Well, that's cool. Tell us about Dr. Boss quickly, and then we'll let people know where to find you.
Yes. So our company is called Dr. Boss, is where we help, because of my experience and success online on YouTube. I want to help other doctors do the same thing. Because I feel that what you don't know, you don't know, right? So I have found a way to like be able to work from one to many, meaning instead of patient one to one, I'm able to impact one to many, because one of my video, there's 1.4 million views every time I put out a video, and in the last 30 days we have 4 million views. And so what that means is I'm impacting 4 million people, and I feel that doctors should consider going online to our company. It's called Dr. Boss, where we actually coach and help. We are kind of like the mentor and how they can set up their channel, but we're also the chief content officer, meaning we help them do research on the content, and we will do the editing itself. All the doc need to do is to record the video, which our team and I will help them come up with the topic and the niche that we feel that is people are looking for, and then all the doctor to do with the content, and we publish everything on YouTube and on podcast, and we can also publish it on Instagram and Facebook as well. But we're also helping doctors how to get the viewers to become someone that buys from them by creating something like a newsletter that's free, and then you get the information, then you send them emails, and then they eventually will be in what I call in your world, and then they want to have more time with you, and that's when they start buying either your product or your course or a membership. I love membership personally. I feel that a doctor can do a membership on how to manage your diabetes for a lifetime, because diabetes is like weight loss. You have to. It's something you need to do continuously. Or like I'm working with a doctor right now, and where she's an OBGYN, and she is going to do a coaching program to help first time mother over 30 have a relaxed and healthy pregnancy. Because what she finds out in her practice is that a lot of people that are first time pregnant, they're very anxious, they're not enjoying the journey as they should. So she's creating that membership, to creating the newsletter, and then we're also helping her create a cookbook as well for women that are pregnant. And then I'm working with another doctor right now that is going to be helping women over 50 in menopause lose weight, but African American women. instead, because that, they have certain challenges as well. And we're working with another doctor right now that is going to be doing putting out content on helping women with stress incontinence and how to manage that, after the age of 50 as well. So very hyper niche, but much needed area. And I wish that I can work with a doctor that can help somebody with diabetes, or even thyroid problem. Oh my God, thyroid, diabetes, hair regrowth, is much needed as well. So we're now able to really help you hone down on the topic and get you out there to be searchable. One of the doctors we were working with, she's a pain management, and she does everything from head to toe in pain management. She's now putting out content just on knee right now. And for 4 years, she was on YouTube trying to do it by herself. She only had 30 subscribers and only 2,000 views for 4 years. After 30 days of working with her, we got her to over 600 subscribers, and she now had 30,000 views after 30 days of working with her and producing. I think we produced like 8 videos so far. Is because we figure out how to find out what people are searching for, and then when you put out content that people are searching for, they're gonna click on it, right? Because for me, I'm a menopause lady. I'm not gonna click on something that is like weightlifting or something. That's not my interest. My interest is like, okay, well, how can I stop hair loss, during menopause? That's something I want to click on, and I will click on that. So it's all about knowing what triggers people are looking for, and then putting the content for that. Because if you're putting out content that you think that people need to know, they won't. You have to put out content that people want. And then once they start watching your channel, then you start educating more.
So it sounds like to work with you, the doctor, all they have to do is create the content. You're helping them research, you're helping to create the thumbnail, you're editing. All that we as a doctor do is just say, here's the video, and
Yep.
then you go ahead and
That's
do the
it.
rest.
Because you know what? I'm a doctor too. I know that you don't have time to do all that, and you don't have the skill to do it. You don't have the staff to do that. So I'm creating a business that I know that doctors need, because I'm a doctor too, and I know that it's hard. It's hard enough to just sit in front of the video to create the content, but you are the expert in that. So we leave you that, but we do the rest. So I created something that will support you from A to Z. And because I've been there, done that, and that's why it's because I created this for me, and then now I'm just replicating it for the doctors, so that way it'll make it easier, and all they need to do is just record. I'll even tell them to how to record. There's a way in the first 30 seconds of you putting out a video there that will retain people, because YouTube will reward you if you have somebody watch your video beyond 30 seconds. So that first 30 seconds is very valuable real estate time, that you have to say something that's a hook, strategically, that will keep somebody staying beyond 30 seconds, because most people bounce off after 30 seconds. That's a very short time span. I know 30 seconds, but there's a way that but because you know why? Because I pay for coaches too. I pay for coaches to teach me that. And it didn't come out of my head. This is from learned experience, and investing in myself with this skill. And I'm paying forward to the doctors and really showing them the step to do it, and making it easy for them to get out there and start making money. Like hopefully 14 sources like I've created with my online content business.
I love that. So where can doctors go to find you if they would like help with their YouTube channels?
Oh, yes. So the best way is they can go to www.thedoctorboss.com is our URL. I'm so glad I bought that URL. Or best way is to connect with me on LinkedIn online. On LinkedIn online, I'm at Dr. Ann Truong. And connect with me online. And I personally respond to all the LinkedIn messages. I may not respond to Instagram or Facebook like that. Honestly, I'm not on there a lot, or even on YouTube, or go to thedoctorboss.com and there is a live chat widget. You can just enter your information on there, and we will connect with you from there. Try to make it
Great.
very easy.
Well, thank you so much. I hope that someone watching this will go start their YouTube channel and hopefully they'll contact you to help out. Thanks for joining us today.
Well, thank you for having me here.
All right. Bye.